have some news. I mean, technically it's not hot news anymore because I was sick when the news came out and I couldn't shoot, but I'm here now, so bear with me, it's still relevant and interesting. The Ontario government is banning supervised drug consumption sites within 200 meters of schools and childcare centers. Which makes sense, doesn't it? Except for the other policies that they're also trying to push. But yeah, moving consumption sites further away from schools is something that makes sense, and I completely understand that if you're a parent, you want to spare your child from seeing this on their way to school, or you want other children, safe, and you don't want these people interacting with your kids. And promoting conflict de-escalation is something that makes sense. Policies to discourage loitering make sense sometimes, depends on what the policies are. And making life in the neighborhood better and safer is something that makes sense, yes. The issue starts when people cannot agree on what policies make sense, what would actually make life better and safer in the neighborhood. What does not make sense is this proposed legislation that, if passed, will prohibit municipalities and organizations from opening new consumption sites or participating in safer supply initiatives. The legislation would also prohibit municipalities from requesting decriminalization of some illegal drugs. For instance, Toronto requested the decriminalization of possession of small amounts of heroin, fentanyl, cocaine, and methamphetamine. And why would decriminalization of drug possession be a good thing, you ask? Well, glad you asked. Well, these end users are mostly just carrying small amounts for themselves to cover their needs. They're not some huge distributors, and decriminalization can reduce the stigma these people face and just lower the barrier these people need to overcome to get some help. Plus, a criminal record can significantly harm the chances of your life ever improving, even if you work hard. And people died because they were afraid to call for help because they had drugs and they didn't want to get into trouble. And these safe consumption sites are not just for funsies. They are a serious medical service that saves lives. Taking drug under supervision greatly reduces the risk of health complications and overdosing. And you might argue that a person will greatly reduce the risk of these things if they do not take the drug, but it's not that simple, is it? People who use these services are often in horrible life situations they cannot get out of, and they cannot deal with sudden withdrawals of drugs. They're not in a position to deal with that issue. And we know from research that addiction is way more than just failure of will and very far away from what you'd call a personal choice. And if these facilities are available to people, there will be less people who are shooting up drugs in your park. And Canada invested a lot of money and resources to open these services, and it's not even that long ago. Some of them were opened in 2019. Now, these facilities can either close or convert to something called a Heart Club, a homeless and addiction recovery treatment hub. And from what I've read, these heart hubs will unfortunately lack in several important areas. For instance, they won't be able to do needle exchanges, which is a major issue. Needle exchanges make the world a safer place for everyone, especially for people who use drugs, but also for people who don't. And this is a huge argument for people who don't care about the well-being of others, they are cost-effective. It's way cheaper to provide clean needles than it is to treat HIV or hepatitis. Needle exchange programs are important from both public health and financial perspectives. And I don't think that closing them is a strategic decision. The decision to include collection services in the heart hubs is still on the table, but really the one-to-one exchange programs exist because you need to motivate the people to bring the dirty needles in, right? Because it's this whole system where you get one clean for one dirty, and I think that if you don't have this motivation, the numbers will go down significantly. And this will result in less safe public space. And the mayor of Windsor actually said that this is a real game changer and will help people get treatment and recovery, but I don't really think these are the same target groups. Like people who use these application sites and who use needle exchange programs are often unable, and I want to highlight unable here, to receive treatment for various reasons. There's this baseline of well-being the person needs to be in to even consider other treatment options, and harm reduction strategies are important services that can, over time, raise the quality of life enough for the person to consider treatment. But a simple, your needle exchange program is gone, good luck with your treatment, get sober soon, will probably not work. And these harm reduction centers are not a band-aid solution, as Patrick Brown, mayor of Brampton, put it. It's a first level of treatment for people who are ostracized and alone and poor and generally in a very bad state, physically and mentally. And let's not forget that these people were often failed by the system in one way or another, and earning their trust back is difficult, and without their trust you cannot really treat them. They are not ready for a recovery program, as this program just requires too much. And before you say anything, yes, these people are incredibly difficult to work with, and they are very far away from what you'd consider the right client or the right victim. And that does not mean that these people don't need help, they don't need services, and their situation can never get better, because it can with the right guidance. So these people need these services, and I do agree that having these centers close to schools and other crowded public spaces is not ideal, and we need to focus on better city planning, but closing these centers is going to make the current drug situation probably worse. And unfortunately, we can probably expect increase of using drugs in publics, overdosing and death, and dirty needles lying around. Premier Duckford also said, and I quote, "This was supposed to be the greatest thing since sliced bread." And I don't know about you, but I think that you shouldn't say that in an official statement. And it also sounds a bit naive. It sounds like there was this expectation of this magical solution that would just work and goodbye drug problems, but it's a process, not a one-off invention. And I also feel like this statement lacks compassion towards people suffering from addiction, and the plan is clear: treat them, house them, and get them a good paying job. Solve the issues, how simple, right? I mean, even people who struggle way less struggle to get good paying jobs. Yes, that's the plan. And while it might sound like a reasonable proposition, it's one of those cases when you're helping to make yourself feel good, not to actually help. If you actually want to help someone, you're interested in their needs and try to give them the resources they need and want. You don't shove the help down their throats and pat yourself on the back, "Oh, good job," while they suffocate on the consequences of your actions. Or if the person refuses the help because it's not the help they need, you get angry because they obviously are ungrateful and don't want anything. And the government even requested 2 external reviews, and both were against this. One recommended keeping the facilities open and implementing better security plans, while the other one supports opening more of these services, or expansion of these services. But unless anything changes, the sites should transform to hard hubs or close by the end of March 2025, so we will soon see the consequences of these policies. If it works, great, I'll be happy, but I have my doubts. And what do you think? Let me know in the comments, I'd love to read your opinions. But that's it for today's video, so see you next time. Bye!